Okay, foam rolling for the glutes and the piriformis muscles. We're going to start off just by having a seat on our foam roller. You want to cover the whole area. So origin way up at the top here, down to insertion. You'll get a little crossover into the hamstrings there. I like to make sure that I'm bringing the blood flow in first. So just a nice easy pressure. Don't do anything too intense right off the bat. After we've kind of warmed them up, after about 15-20 seconds, I like to just kind of isolate one at a time. So right now we're focusing a little more on the right. Switch over to the other side, a little bit more for the left. And again, I'm moving through these a little faster than I normally would. This one is going to be a little bit more specific for the piriformis. So now we're kind of opening up that hip joint, making a figure 4 with my legs. And then rotate in towards that right side a little bit just to really isolate that muscle. And when you find it, you'll know because it talks to you. It's a tender spot. And it's more so tender in a lot of athletes, a lot of runners. Kind of a problem area for some people. Can even refer pain down the leg in some cases. So once you find that spot, now we're doing a much smaller roll. So we're not doing as much of a broad sweep as we did with the glutes. Again, we'll go over to the other side, cross to the other leg, rotate to the left a bit, find that tight, tender fiber, and just a little bit of pressure right there. And that's it, glutes and piriformis. Foam rolling for the hamstrings and the IT bands. I'm going to start even pressure on both sides and just roll right up to the origin, down to the insertion. So full length of those hamstrings if you can. If you need to break it up in twos, you can start with the upper and then do the lower hamstrings. Rotate the toes out for a few, rotate the toes in. So now we're hitting different aspects of those muscle bellies of the hamstrings. Definitely feel a difference there. Once we've warmed them up, brought the blood flow in, now we can isolate. We'll start with the right. Same thing right here. And I'm going to rotate my whole thigh. Again, so I got a little bit more pressure. And we're not just staying in one plane, we're kind of moving around. Do the same thing on the other side. So now we're isolating that left. Oh, the pressure's on there. Doesn't feel too bad because I've warmed it up though. More the outside, a little bit more the inside. Okay, and again we're kind of cutting back on the time. I'd normally do that maybe another 30 seconds or so just on each side. Next we're going to go over the IT band and the TFL. So right here, definitely a pretty tender muscle group. For this, I try to roll the whole thing out all at once. Again, don't cross the knee joint. You can have your leg forward. As you do that, you can get a little bit more into the anterior part of the hip there, the TFL. A little bit of a soft tissue muscle belly right in there. Most of the IT band is all fibrous tendon though. Okay. Another way to do that is taking the leg behind. Now we can work a little bit more the posterior side of that IT band. Same technique though. Then we'd work the other side, and there you've got the hamstrings and the IT band. Foam rolling for the gastrocs and soleus. We're going to start just like we've done with everything else. Nice even pressure, both sides. Rotate the toes inward. Rotate the toes outward. I like to spend about 30 seconds or so here, bringing that blood flow in. Okay, after about that amount of time, we're just going to isolate one at a time now. So I've crossed my leg, over the right one here. So we're isolating that right calf muscle. Make sure you're hitting all aspects of it. And then we're going to switch over to the left. Same thing. You're going to find some tight knots. You're just going to stop, compress for about 3 to 5 seconds. And then move right on. And there you have it. Foam rolling for the gastros and soleus muscles. Foam rolling for the quadriceps and the hip flexors. We're going to start with nice even pressure both sides here. Make sure you try to keep your back fairly flat. Roll down and then right above the knees. Try not to cross the knee joints. If you can even rotate your toes in. Rotate your toes out just to make sure you're getting as much of a broad contact as you can. Once you've brought the blood flow in, kind of relaxed and warmed up those muscles, now we can kind of isolate one at a time. You can cross one leg over, or you can just shift your weight more to one side versus the other. Again, we've kind of warmed up the hip flexors by this point. The way to really get at that is to kind of scoot down to one end of that foam roller and come all the way up to the iliac crest, right back down. Just about a third of the way down your thigh, back up to that iliac crest. And that's going to be hitting and isolating that hip flexor. We do the same thing on the other side. Again, just on the far end of that foam roller, isolate that hip flexor right from the top of the hip there, all the way down about 1/3 of the thigh. So there you have it, foam rolling for the quadriceps and hip flexors. Foam rolling for the inner thigh or the adductors. We're going to position our foam roller a little differently here. We've got about a 90-degree angle bent at the hip. Working inner thigh all the way down to the knee. Just remember not to cross that knee joint. Any groin injuries, groin pulls. It's a really great therapeutic exercise to kind of break up any scar tissue or adhesions in there. And there you have it, foam rolling for the adductors or inner thigh. Foam rolling for the tibialis anterior and peroneals. I'm going to position it right on the shins here. Another one of those funny looking exercises, but if you've got shin splints, if you've got knots in those tib anterior muscles, this will definitely be effective. Make sure we start off by rolling them, bringing in that blood flow. Nice even pressure on both sides. You've warmed them up for 20-30 seconds. Now we can try to isolate those little trigger points, those tight spots. Hold 3-5 seconds. Move on to the next one. Again, now we're isolating my right side here, so I got a little more pressure on there. All the way down to the ankle. No real need to cross the ankle joint though. Okay, we're going to switch over to the left side next. Find those trigger points, compress, and then move on. As you take that pressure away from the muscle, you get hyperperfusion, so a lot more blood flow comes in and ultimately relaxes that muscle. And there you have it. Foam rolling for the tib anterior and peroneals.